My name is Sharon Johnson. I am the Executive Director of the Central Valley affiliate of Susan G. Komen for the Cure. We are a breast cancer organization that raises awareness and funds to fight breast cancer in the Fresno County area. Our key education talking point is early detection saves lives. And I'm proof. And when people like me share my story that twice now early detection has been key in saving my life, that's the talking point. But the statistic is this: if a woman is diagnosed in an early stage of breast cancer, like a stage 1, her relative survival rate in a 5-year period is 98–99%. Every breast cancer patient has a unique problem and a unique condition. So when they do call, it's an interview. First I ask them to share their story, and they're there for help, so they're willing to answer any questions that I have. But depending upon what their particular problem is, then I can take that information and offer resources. When I first became acquainted with Jamie, she called me on the phone. I'll never forget this phone call because I had never heard from such a young woman. She was 27 years old with breast cancer and pregnant. So while I was trying to find resources for her, she was also trying to find resources. She needed a little bit of outside advice for a woman so young, as far as going through chemotherapy and surgery thereafter while pregnant.
And the doctor confirms that the baby is doing great and has a strong and healthy heartbeat. But before we run out of the appointment, he follows up with, "Do you have any questions or concerns?" I say, "As a matter of fact, I do, doctor. I felt a lump in my breast." Without saying anything, once I pointed it out to him, the lump, he turns around, he writes a prescription. He then turns back around, hands me the prescription and says, "Tomorrow I need you to have an ultrasound. And then Wednesday you're meeting with a surgeon." And I ask with obvious concern, "I don't understand why I need to meet with a surgeon." And he explains that he cannot tell me what the lump is. He doesn't know. He just did a clinical exam, but he feels it, and whatever it is, it needs to come out. And so the radiologist came back in, and impulsively I blurted out, "What do you think it is? You've been doing this for 30 years. What do you think it is? Can you please be honest with me?" And he said, "Oh, absolutely, I will be honest with you. And if you want to know, I'll tell you what I think. But I don't think it's good. I think you have breast cancer." And strolled out of that appointment about 1 o'clock, shaken, worried, confused. And I got in my car and called my mom, and I called my husband, and I called my best friend. And I said, "Well, they said it doesn't look good. It looks like I have cancer, but we won't have anything confirmed until the next day when the pathology report gets back. So let's not panic." The surgeon made sure that we were the last appointment of the day. I now, in hindsight, realize why we had to be the last appointment of the day. And she spent all the time in the world answering every question. But when she walked into the doctor's office in the patient waiting room area, she sat us down at a table and she said, "I'm very sorry. You have breast cancer, and you and your baby will be okay." So she didn't miss a beat in saying, "You have breast cancer, and you and your baby will be okay." You have breast cancer, and you and your baby will be okay. So that's really what I heard. Well, I reached out to Komen because they were listed in the Fresno phone book as the breast cancer organization in the area, and Sharon Johnson answered the phone. And she was so kind and generous and asked me if there was anything she could do for me. And I explained that I am very grateful that I was in the fortunate position to have a great support system in place. But no matter how much support my loved ones could give me, I still had some questions and concerns and fears and a lot of sense of isolation while going through breast cancer as a young woman while pregnant. So I asked Sharon, "Is there anyone in your organization that I can talk to about some of my fears and concerns and ask questions to?" And she said, well, she identified herself as a survivor, and she was happy to answer any questions, and she could put me in touch with other area survivors. And I asked Sharon, well, what can I do to help your organization? Because I want people to know this can happen to other young women. And she said, oh, we would love to have you help. But why don't you get through chemo and we will stay in touch. And so Sharon continued to check in with me during my chemo and send me notes of thinking of you and very thoughtful emails. And we stayed in touch during my treatment, and she became a very close friend of mine.
Working for the Central Valley affiliate of Susan G. Komen for the Cure has really afforded me the opportunity to network with other survivors. I've had the privilege of knowing Jamie Ledesma and many other breast cancer survivors. So we've all taken the opportunity to share our stories with other breast cancer survivors. It's a solidarity with those women as well as a sisterhood, and have the opportunity to educate those that have not had breast cancer. If you're a woman in the Central Valley, or in fact a man, because men can get breast cancer too, and if you have questions about a diagnosis of breast cancer, a lump that you found that hasn't been diagnosed and you need medical care, or just information, or you're a co-survivor that needs to take care of somebody with breast cancer, please call our Komen Central Valley affiliate office at area